Hi, everyone. Welcome. This is panel 5, Managing Challenging Emotions on the Path to BPD Recovery. My name is Courtney, and I am here coming from Long Island, New York. We encourage you to use the chat function to share where you're coming from as well as we do the introductions. Before we begin, if you have not already done so, please consider making a gift to Find Emotions Matter peer programs throughout the year. You can text to give or make a bid in the silent auction by clicking on the silent auction button. We have some great items, and this will make a really big difference in continuing our BPD programs. So just before we get started, I'm just going to share some of our policies. Give me one moment while I share my screen. So Emotions Matter is a 501c3 nonprofit organization founded in 2015 to support, educate, and advocate for those impacted by borderline personality disorder. To learn more about us and our programs, you can go to the website emotionsmatterbpd.org or go ahead and head to the expo. So just some of the Emotions Matter philosophy. Emotions Matter strives to create a safe, judgment-free space for people with borderline personality disorder. We accept that there is a spectrum of experiences within the BPD community. We honor where people are on their journey without judgment or assumptions. We encourage people to find their own path toward recovery. And we speak as experts of our own lived experiences and not as medical experts. Okay, so I just want to go ahead and start introducing the speakers today. Our first speaker is going to be Dr. Beth Brodsky. Dr. Beth Brodsky is an associate clinical professor of medical psychology and psychiatry at Columbia University and a research scientist at the New York State Psychiatric Institute. Her area of expertise includes research and psychotherapeutic treatment of self-destructive behavior in borderline personality disorder. She has published numerous articles and chapters on the topics of suicidal risk and treatment of suicidal behavior in borderline personality disorder. She is also trained in dialectical behavior therapy and teaches DBT to psychiatry residents and psychology trainees. She also has a private practice in Manhattan. So at this time, I'm going to turn it over to Dr. Beth Brodsky.
Okay, can everyone hear me? Thank you so much, Courtney, and it's a pleasure to be here to this panel about challenging emotions and situations. And I would like to start by saying the way I think about it. I was asked to talk about the science of emotions, and I'm not going to talk about scientific facts about emotions, but more theory that can drive treatment of borderline personality disorder and the emotional dysregulation that I think causes the difficulty. So I'd like to say that emotions themselves are not difficult, right? We all know emotions matter. We need our emotions. So it's really more about the dysregulated way that we experience emotions sometimes. And that can be extremely distressing and painful. So we do need to have our emotions. We don't want to throw out the baby with the bathwater, but they give us wisdom and they give us information for survival. We need our emotions to tell us when there's danger, when something's not right and we need to do something about it, when we're doing something that we need to improve on. We need our emotions. And some of the theory about borderline personality disorder is that people with that disorder tend to experience their emotions extremely intensely. That's actually a superpower, really. But like all superpowers, we need to learn how to control the superpower. So once we do that, it's like taming a wild horse. That's the metaphor that I like to use when I talk about this with clients and when I teach, is that we have intense emotions that can take us for a great ride as long as we're in control of the reins. So the thing that makes it difficult and distressing and challenging is the emotional dysregulation. So what is that? I know in my introduction, I was introduced as someone who's trained in DBT, dialectical behavior therapy, and I teach and I write about it. I know that a lot of people are familiar with DBT and hopefully have found it helpful for them. Some people haven't, and that's understandable. But I think some of the theory about emotion dysregulation can be very helpful in trying to understand and inform us as we try to help manage the difficult emotions and situations. So from my understanding, emotion dysregulation can come from an inborn biological vulnerability to experience emotions in a very intense way and to get very emotional pretty quickly. So like going from 0 to 100 very, very fast when there's some kind of precipitant or trigger in the environment. And in addition to an intense emotional arousal, it's usually accompanied by a physiological component, so that you go from 0 to 100 very, very fast, and your body gets very activated. And what happens when that happens is your thoughts can also get dysregulated. And this emotional dysregulation and the cognitive dysregulation can lead to behavioral dysregulation. Behavioral dysregulation can either be a tendency to impulsively act on an emotion or to do something to not feel the emotion. Often behaviors that cause problems for people are the behaviors to try to escape from experiencing the emotion. And it makes sense to want to escape experiencing it because it feels so overwhelming and distressing. So that's what makes it so difficult and challenging. Also, when you're in this aroused state where your emotions are heightened, your body's aroused, your thoughts are getting confused and dysregulated by the whole experience, it tends to narrow our attention so that we're only aware of the thing that's bothering us. And it's hard to keep a larger perspective of the other things that are also happening that are not necessarily bothering or distressing. Aaron Beck talked about the cognitive triad of depression, where if you're in a depressed mood, or I would say in any kind of emotionally aroused state, you either only remember things that are related to your current emotional state, or if you look into the future, you only can anticipate feeling that same way. And in the moment, you're only able to notice things that go along with the feeling that you're having. Another term for it is mood dependency, that the mood and the emotion colors how we are perceiving everything. And we tend to feel when we're there in this emotional dysregulated state that we are never going to feel any other way, which is not true because emotions always fluctuate. You never feel the same way all the time. And that's for feelings that are distressing and also for positive feelings. They don't last forever. When people are born with an inborn emotional vulnerability to experience emotions in this way, it's very hard to learn skills for coping. Sometimes it's hard for the people around them to help them learn coping. So they're kind of left to their own devices to cope, and they do the best that they can. But sometimes those ways of coping cause more difficulties. So because, again, that wanting to get rid of the emotional experience in the moment because it's so painful might lead to other problems later on. But it is a way of coping in the moment. And so people who are experiencing this as they're growing and developing start to feel that they can't trust their emotional experience, and that they assume that when they get very emotional, it's going to lead to destructive behaviors or things happening, or difficulties in their interpersonal interactions, feeling very intensely distressed. And so there becomes a fear of having the emotion. So that's the kind of thing that we want to work on in terms of addressing challenging emotions and situations. And one other thing I want to say before I move on to the speakers who are going to share their experience with this, and I really want to hear that and ask them if this makes sense the way I'm talking about it. In addition to a biological vulnerability, early trauma also contributes to this kind of emotionally dysregulated experience. Emotions can seem to come out of the blue, but they're actually triggered by something that happens in the environment that might trigger a past trauma memory, or a person who has a history of distress of some kind might be tending to see something that's happening in the present through the lens of that past experience, and they might misinterpret what's going on. So you might perceive a threat even when there isn't one. That leads to having an emotion that might not seem appropriate to the situation. So you think, what's wrong with me? I'm feeling so upset when nothing's happening. Or somebody around you is saying, why are you so upset? Nothing's happening. But something is happening. It's just that the thing that's happening might not be the same thing that was happening in the past. So sometimes when that happens, it can lead to being invalidated by people around you saying you're getting upset over nothing, or you self-invalidate. You say, there's something wrong with me for having this emotional reaction. I just want to put out there that feelings are always valid. Sometimes the interpretation of what's happening and the thing that you're responding to emotionally might be a distorted interpretation that is informed by past experience. And so that can also lead to feeling dysregulated and feeling that the emotion is difficult because there's a sense of disconnect between what's happening and the emotional reaction. So I think that's about what I want to say about it. So thanks, and I'll be back later to share a little bit more.
Thank you so much, Beth. I'd like to introduce our next speaker, Jillian Papa. Jillian is an Emotions Matter board member, peer facilitator, and program evaluator. She was diagnosed with BPD in 2012 and continues to work toward recovery every day. So I introduce to you, Jillian.
Hi. Okay, thanks everyone. Happy to be here. Tell you a little bit about myself and a little bit about my journey. Like Courtney mentioned, I'm Jillian Papa. I was diagnosed 2012 with borderline personality disorder. And at this time, I do identify as being in recovery. And what that means for me is that I'm just like living a life worth living in particular. And also, I guess more scientifically, I no longer meet the diagnostic criteria. I've been able to get to a point where I can manage some challenging emotions and situations. And so for me, from the beginning, I always knew there was something different about me, about the way I manage situations, relationships, my emotions. I started to notice when someone close to me would say or do something that would upset me, my brain would immediately start to think all kinds of things, and I just couldn't slow it down. Beth said so many things I connected with, and I see some other people in the chat connecting with some of the things she said as well. The 0 to 100 that Beth said, the spiraling, and then for me, really the mental health manifesting in my physical health. So that's where I was starting to get physically sick, and I was like, something's not right. I'm different, and I'm not able to manage some of the things people around me seem to have a better grip on. And so my journey for me, the biggest thing for me was learning and educating myself, because I had no idea what was happening. But again, I knew something was off. And so my big first step was seeking professional help. And I recognize that that's not necessarily everyone's first step. And I know there are many issues with access to care. So I just want to acknowledge my privilege in being able to seek resources and professional help. But that's really where I began. And I was introduced to DBT. And again, there's so many treatments and so many methods, and different things work for different people. But for me, in my lived experience, DBT really saved my life. There was a lot of great skills and resources that I was able to use and tap into, particularly in thinking about this topic, managing challenging emotions and situations, distress tolerance and emotion regulation, just learning little things about like sensations and journaling and contributing. Like the fact that I'm here talking about this is making me feel good, and help me regulate my emotions. Just all these different things that I wasn't aware that I could be doing versus screaming at the top of my lungs or, fighting with people. Just learning different skills that are evidence-based and proven to help folks like me. So really, even to this day, just constantly taking in information, being in this conference, hearing from other people, what has worked for other people, could it work for me? And then learning even the science, like Beth described today, and Sarah Feinberg, I've heard her speak a number of times about the way my brain works and the way, what I could be doing to help it just really has been tremendous for me. And along my journey, learning about emotions, identifying them, understanding them, just going beyond saying, oh, I'm angry or sad, but understanding shame and guilt and where all of that comes from. And identifying my triggers, which Beth also mentioned as well, as a big part of it. So anticipating them, identifying them, and then being able to manage them when they show up. So those are just some of the things. And I think, the one other thing I was going to say is taking care of myself at baseline. So the bare minimum, trying to remember to eat food, move my body, and get some sleep. I know that sounds silly and so minimal, but I noticed over time, if I weren't working on those three things, I was so much more dysregulated. So just having those minimum needs to have a good foundation. And really over time, practicing the skills from DBT, taking care of myself, little by little, over the last 10 years now, I've started to see myself improve. And it's just incredible to notice the way that I've been able to react in situations in the past when I wasn't able to. So I consider that progress. I consider this a journey. It's not a destination, or I'm not there yet, right? I'm always working towards it, and I'm always managing. And it's just all about the small steps and the journey. So thank you for having me here.
Sorry, I turned my mic off. Thank you so much, Jillian, for sharing your experience with us. I'd now like to introduce our next speaker, Melissa Ferdinando. Melissa is a parent of a daughter with BPD and currently a vice president on Emotions Matter Executive Board. So I introduce Melissa.
Hey, everyone. Thank you, Jillian. I'll be speaking similar things to what she was saying. But I'm Melissa. I have a 28-year-old daughter who was diagnosed with BPD when she was 19. I'm here to give you a parent's perspective of what it's like to try to help your loved one who's suffering from emotional challenges. I'm not a doctor or an expert on BPD, and I can only tell you what has worked for me and my daughter. Allison was an outgoing and friendly child who commanded a lot of attention. When she was 10, she began having problems with relationships. Although her teachers loved her, she was having difficulty maintaining friendships. The girls in her class would talk about her behind her back. She was never really part of a group. We tried activities out of school, but the same things would happen. She was really having a hard time dealing with it, so she began therapy. And by middle school, she was seeing a psychiatrist. Her diagnosis through middle school and high school was major depressive disorder and general anxiety disorder. Before her diagnosis, and even after that, I made a lot of mistakes, particularly in her teen years, and I would only make situations worse. I mean, teenage girls are emotional, so when she would have outbursts, I would just Tell her she was overreacting. Why are you so upset about this? This is no big deal. Let's move on. It's not the end of the world. All those things. As she got older, like 17 or 18, it just got worse. One minute, everything was fine, and the next minute, all hell broke loose. She'd be screaming at me or crying. She'd be lying on the floor, or she'd be curled up in her bed, and she'd be saying things like, it would be better if I just died. So it was very heartbreaking, but it was also extremely frustrating. At times, I would get very angry. We would yell, we would fight. She would say horrible things to me. Stuff would get broken in the house. Sometimes I would just have to leave. And then when I'd come back, I would find that she trashed her room or she self-harmed. And then I would get angry all over again. I would also feel sorry for myself. I would think, when is this ever going to end? I can't take this anymore. Then I would think, okay, she's going away to school soon. She'll figure it out. She has to get more mature. She'll be fine. But that wasn't the case. After coming home from her second college attempt at 19, Allison was diagnosed with BPD and entered an intensive outpatient program and started DBT. So I thought, okay, I never heard of BBT. I've never heard of DBT, but this will help and she'll get better. So I started educating myself about BPD. And that's when I realized it wasn't going to be that simple. I attended class in New York, and the things I was taught seemed ridiculous. I was supposed to react and act to her and speak to her in different ways that seemed impossible. But I knew that what I was doing wasn't helping, and I was going to have to change the way I responded to her. So I learned how to validate her feelings, even if I didn't agree with them. And I learned how to spot situations that were going to cause her distress or emotional pain. When Allison's mood would shift and she would suddenly lash out, I would try to put myself in her shoes. I'd figure out what led up to this, why the sudden mood shift, what was the trigger, and why did it escalate so fast? So I tried to figure out her emotions because she really didn't understand them herself. She was angry right now, but why was she angry? What was the trigger to it? And then I would realize, oh, that's what happened. So she's really not angry, she's afraid. Or she's really not angry, she's ashamed of something. The biggest issue we had was abandonment. If I had something to do after work or on the weekend and she didn't, I could almost guarantee there would be an episode prior to me leaving. There were many times I had to change my plans or come home early, and this would make me very resentful. Then I realized that to her, it felt like I was never coming back, and she was scared. So we would talk through it. I would say, I have to do this tonight. It must feel like I'm never coming back. At the same time, I always do. I have to come back because I live here. And then she would say, then I would say, it's only going to be for a certain amount of time, so what can you do to keep yourself busy? And she would make a plan. There were times when she was so dysregulated that she would self-harm. Among other things, Allison would punch herself or bang her head on the floor or wall, sometimes almost to the point of knocking herself out. And I would think she has to go to the hospital. I can't help her. I can't do this for her. But then something in me would say, stop, don't take her to the hospital. It's not where she belongs. So I learned to have tools around for various situations. When she was completely dysregulated to the point of self-harm, I would get a bowl of ice and plunge her hands into it, or definitely call her therapist, but I would have to call it myself and hand her the phone. If it was a milder episode, sometimes I would just sit with her and have her breathe. Or if she was just crying or sad, we would put on something silly on the television, like a comedy or a reality show. If she became dissociated, I would get a squishy ball or Play-Doh and physically put it in her hand, or stick one of our cats in her lap and have her pet it. Sometimes I would have to start the shower and just put her in it. When stressful situations would come up, like holidays or large gatherings, the day before or the day of would always be very difficult. So I started to break down the situations prior to the event and would ask her, what do you think will happen? What's the worst thing that could happen? I'll say, okay, how are you going to handle it? If your aunt asks you why you're quit school or why you don't have a boyfriend, have an answer ready. And she would. Another thing was to have an escape plan. Just only stay 2 hours. That's your plan. Give yourself permission to leave. These are probably skills to cope ahead, but I feel they're empowering and can lessen the escalation of her emotions. Other situations in her life were jobs and school. She stopped and started school several times, and she had several different career paths. As far as school, she would say things like, everybody else has already graduated. I'll never be able to do this. It will take too long. It's too hard. And I would tell her, you don't have to do this now. You will, but just not now. And she did. She finished college in December at 28 years old and is looking into master programs now to become a speech therapist. When it came to jobs, Allison was always good at what she did, but eventually it would become too much. She would get paranoid, her coworkers were talking about her, or she was going to get fired, or she hated the people she worked with, or that her boss was taking advantage of her. She wouldn't want to quit because she didn't want to fail or let us down, but at the same time, it would be affecting her mental health to the point of almost breaking. She couldn't function. At this point, she was probably 23 years old, and as a parent, I don't know what to do. I can't support her forever, but I tell her, you're not a failure. It's only a job. I would almost have to give her permission to quit, but at the same time, tell her she had to make some kind of plan beforehand. There are people who would tell me I wasn't helping, that I was coddling her, but I always felt I was doing the right thing. I knew she wasn't ready to be self-sufficient. What if she had cancer or some other disease, something tangible? Then people would have compassion because it would be my duty to take care of her. And that's how I felt. It was my obligation. She didn't ask for this, and I was going to do everything I could to help her. Looking back, Allison, I realized that at the time I was actually managing her emotions for her. And that probably wasn't the healthiest thing, but I don't care. I don't know if she will be alive today if I didn't. And I know she's thankful for it. As she progressed through DBT, she learned to manage her emotions on her own. I became more of a cheerleader. When things got tough, I would tell her, this is going to suck. It's going to be hard, but you've got this. You've done hard things before. And I would remind her of a time when she did something hard. Or if she came to me with a particular stressful situation, I would try to help her by saying, let's figure out your options. That eventually led to, I can't make this decision for you. You'll figure it out. And she would. And she still does today. Having a child with BPD is challenging, to say the least. There are many times when I said to myself, I can't do this anymore. I can't live like this. Will this ever end? Friends and family don't understand, so it's very isolating. But we can't understand the emotional pain someone with BPD is in. I just want to say to parents or other family members, try to recognize the triggers. Don't be invalidating to feelings you don't understand. Try not to let situations get worse and cause emotions to escalate. Try to be as supportive as you can. If you can't find the right words or reactions, then sometimes just being there is the best support you can give. And I will turn it back over to Courtney. Thank you.
Thank you so much for that, Melissa. I'm going to present our next speaker, which is Tabetha Martin. Tabitha is a family member and previous caregiver with a loved one with BPD and diagnosed as an adolescent. She's worked to fight stigma through the BPD awareness page, published caregiver guidelines, and a book filled with stories of lived experiences. And as a registered nurse, is hopeful that she can help educate other clinicians on BPD that are not familiar with the diagnosis. Turning it over to you, Tabitha.
Thank you so much. Wow, everything that Melissa shared, I can really relate to and echo. Our family was introduced to borderline personality disorder when we were given emergency custody of my adolescent sibling. Initially, we weren't told of her diagnosis. And when she was placed with us, we treated her essentially in the traditional sense of raising a teenager. Mind you, this was an adolescent who I had picked her up from the hospital because she had been in crisis and she could not be placed back with her parents at the time. So this was a sibling I was always there for, always helped, essentially helped raise already. So we had a pretty close relationship that had been really disrupted through a huge custody battle between the parents, which really really created more of a crisis for her. So our home was filled with love. We were actively involved in counseling, and we still couldn't figure out why things were not getting better. The whole family had gone through a complete psychological evaluation and so forth with the courts, but we had not been told of her diagnosis. She'd been diagnosed by the court psychologist. She'd been diagnosed in the hospital. So she'd been diagnosed with BPD as an adolescent from multiple sources. It just is interesting to me, as many of you might know, diagnosing an adolescent with BPD is pretty controversial and not often done. And when it is done, in many people's experiences, the family member and the adolescent are not told that they're diagnosed with BPD, what BPD is, appropriate things you can do, etc. So finally, we were told of the diagnosis when I just hit a wall, and I called the court psychologist and explained some issues to her. And she said, well, of course, she has BPD, and that's what BPD is. And I said, what? I was a student, my first degree. I was currently studying from psychological sciences, so I was familiar with the diagnosis. And things just started to make sense. And at the time, I knew that, in adolescence, this was not a diagnosis that was typically made. So it hadn't occurred to me that this was what was going on. And getting that diagnosis changed our life, really, for the better. I remember sitting there being shocked. The diagnosis as a caregiver for me allowed me to switch from how I taught her and disciplined her and how I interacted with her. It changed how I interpreted what was going on, how I interpreted how my reactions, if they were effective or ineffective. And that really became the focus for me, was not in changing her. It was in changing the environment around her. How was it validating? How was it invalidating? How was I allowing our roles as parents to react in a way that wasn't helpful to her? So what I focused on, I read a number of books. There's a number of books for parents of caregivers. Not a number. There's a few books of parents of caregivers for those with BPD and adolescents. And they were helpful. They were absolutely helpful. They taught me how to not react, how to reflect on what the mood was, how the environment and the situation really was impacting, an emotional outburst or a breakdown, or positively, even how to replicate those positive experiences. And that was where our focus really turned, was replicating what the positive experiences were, focusing on fostering and facilitating positive interactions, setting up my, child for success, setting them up for in environment that was conducive to what they were trying to accomplish. For example, if they were needing to do school, how do we do that? Do we split these assignments or the things that you need to do into small doses? Do you lower the stimulation of the rest of the environment? If they're in the middle of having a breakdown or a rage, how do we remove the other children from the home, from the situation, and how do we handle it? So for us, it was a give and take. We had to learn what worked and what didn't. For us, removing that absolutely helped. We removed other children from an area when there was an outburst, and just let that outburst happen and walk away and come back or stay there, depending on what was going on. Really, I'm reading some of the comments. Yeah, and meds and therapies were really, Leslie, you're bringing up meds and therapy, and that really is a huge thing for us. Meds did not really help her. And prior to the diagnosis, we didn't understand what was going on. Therapy was not helpful. And having a good therapist makes a huge difference. So sometimes those with BPD can be labeled as people that jump from therapist to therapist, but I can completely understand that. You have to have a therapist that knows what they're doing, that knows how to involve your family, how to interact, how to create a crisis plan. What happens when your loved one with BPD is in crisis? Are they self-injuring? Are they having suicidal ideation? So having those as a parent and knowing that your therapist is really prepared to do that is huge. So it became a questioning of the therapists that were potential therapists to find the right one. And unfortunately, we weren't able to find the right therapist until really ever. And that made a huge difference and huge effect in recovery. Insurance coverage, obviously, is a huge impact. So there's good and bad stories to our outcome. I think the biggest thing that I can take away or that I would like you to take away is not focusing on changing your loved one, but focusing on how you can help change your interactions with them, how you can help validate them. Remember, validating isn't always agreeing. Sometimes you don't agree. Validating is huge. It's recognizing their feelings, recognizing that this is where they're at and this is how they've interpreted a situation, and understanding that the cognitive development and interactions are completely different sometimes with somebody that has BPD versus what you're feeling. So I hope that that's helpful. I hope that those of you who can step in and be there for a loved one, and you don't always have to chase your loved one with BPD, right? Currently, my loved one is grown now, but they know that I'm here. I'm always going to be there for them. And when they need me, they can come back to me and I will be there to help them. So sometimes just, creating that safe space for them is going to make a huge difference for them.
Thank you very much, Tabitha. At this point, we're just going to turn it back over to Beth, who's going to say a few more words.
Okay, well, first of all, I just am blown away by the three of you sharing your personal experiences. And so I could see the journey that you've all learned and grown so much. And so my role as a therapist is to say, how can therapy be a partner to family members and to people suffering with borderline personality disorder? What are the things? And I think all of you have mentioned a lot of what I'm going to say because of your journey. You've already learned what can be helpful. So what I was going to say is it's very important to find someone who's trained in some kind of borderline personality disorder specific therapy, who understands the emotional dysregulation as a sign of intense distress and pain, who understands that the difficult and problematic behaviors, including the interpersonal challenges that you might have when somebody is in an emotionally distressed place, that it comes from a place of pain, and validating that the person is doing the best that they can to cope with intense pain. You want to find a therapist who is willing to discuss suicidal ideation, can balance concern with calmness and not be overly reactive with anxiety or heavy-handed in terms of stepping in too quickly, but also being very alert to monitoring safety. You want a therapist who knows how to use safety plans. I think the plan for crisis is crucial. Instead of somebody who contracts for safety, which is basically saying sign an agreement that I'm going to stay safe without any guidance or support in how to do that when you're in an intense emotional place. So And also the therapist should understand the difference between non-suicidal as a coping mechanism versus suicidal ideation and suicidal behavior, and the overlap between them, but also the differences between them. And again, someone who can validate emotional responses even when they're dysregulated. And also, to Tabitha's point, somebody who is very transparent about and does a lot of psychoeducation to the diagnosis. When I was first being trained as a psychologist, I was told never to share the borderline personality diagnosis with a client, which when I think about it now is astounding. When I was trained as a DBT therapist, that was the first thing I was taught to do, is to go through the diagnostic criteria and have a conversation with someone about whether this is something they're experiencing. How validating is that? Now, again, you know, there's a huge stigma, as we all know, about being diagnosed with borderline personality disorder. And so the way that you talk about it has to be without judgment and without stigma. Again, to Tabitha's point about diagnosing someone as a teenager, very problematic, but and then on the one hand, on the other hand, you know, there's stories of people who get diagnosed so much later and they were misdiagnosed all along. So it's a delicate balance in terms of that. And so you want somebody who has experience with that and can be very thoughtful about that kind of thing. Also, in terms of Melissa's journey as a mother and family member, and to have a therapist who can work with providing support. I mean, all of the things, Melissa, that you learned, that transition from not understanding to understanding, I think there's not enough supports for families to learn those kinds of things. And then all the coping skills that you helped your daughter with, you were scaffolding her to be able to eventually be able to do these things for herself. And it's all of those things are things that I work with in terms of the physiological arousal, the ice and the showers, the coping ahead strategies. So important. And therapists need to be able to share that information and to encourage supports in the natural environment, because team, when it's possible, you know, it's not always possible. I think you need to have someone who knows how to to collaborate with someone to make a good safety plan, which has to do with learning the triggers, as everybody mentioned, right? Also, Jillian was talking about knowing her vulnerabilities, really important to understand those in terms of managing difficult situations. Identifying those interpretations that I was talking about earlier on in terms of what might contribute to emotional dysregulation, those kinds of go-to core beliefs. A lot of times we don't like to live with uncertainty. So when something happens, even if we don't know and we haven't checked the facts yet, we just insert our go-to core belief or interpretation based on our past experience, which may or may not be accurate to the situation. So learning how to take a step back and look at how we're interpreting certain situations and how we can learn how to check the facts. And also having a plan for behavioral coping, right? All the skills that were mentioned here and others, you know, really learning, especially the ones that lower the physiological arousal. So also being able to body sensations are that accompany your emotional distress. And so sometimes that's the quickest, easiest way to calm an emotional storm down, is by intervening with a behavioral a physical skill like ice or intense exercise, breathing, cold, hot showers, intense distraction, also self-soothing, and also learning how to ask for help. I think that's another issue, you know, in terms of the experience of having not such great therapists. Well, that's going to make it really hard for people to reach out for help. There's a lot of obstacles. People experience invalidation of their feelings. They experience overreaction to their behaviors and judgment. And they need to be able to build trust with someone to be able to learn how to ask for help. So when you're doing a safety plan, for example, you identify your warning signs, you have skills for coping on your own, and then you identify people in your natural environment that you can ask for help. And you need to also reach out to your therapist or mental health provider for help. And so those are skills that also need to be taught sometimes, or we have to acknowledge the obstacles that prevent people from reaching out for help, so that sometimes the way that they get help is after they've done something harmful to themselves. And so we want to try to learn how to figure out how to ask for help before that happens. Is there anything else I want to add to that? I don't think so. I think those are the main points I wanted to say based on the experiences that people were so brave to share today about what the role of therapy can do to support people on their journey. And then I had some questions. Okay.
You have questions for us, Beth, right? So if everybody could turn their cameras and mics back on.
Yeah, I just wanted to ask what you have found most helpful in terms of the treatment that you've received or things that you haven't felt helpful. I know you spoke to that somewhat, but any other things that you have to add about that? And what your experiences have been in terms of having therapists who help collaborate with people in the natural environment, or any other things that you want to share.
I mean, I can answer from my experience. I made a lot of mistakes. I still make mistakes today, but we communicate today, and she tells me, and I can then therefore say, well, I didn't mean that. I meant this, or in the right language. As far as therapists, yes, she did go through a few, and a couple of psychiatrists, but she's lucky today to be with an excellent therapist who's actually did some talk yesterday with Emotions Matter, and she's wonderful. And Allison continues to see her today.
Leslie asked specifically, and I think that the question was answered, the list of questions when trying to identify a good BPD therapist. I wanted to be a little bit more clear maybe on what I would have done differently. What I would have done differently is not asking, are you familiar with BPD? Well, we started therapy before we even knew she had BPD, right? But in other therapists, I would ask specifically, what is your practice when you're working with somebody that has BPD? How do you feel about borderline personality disorder and the chance of somebody that has it experiencing recovery, right? Because you want to gauge what their attitude is in general. You know, are there any groups, collaborative groups you're a part of? One big thing on the professional end is those that have patients and clients that have borderline personality disorder, it's often suggested that they have their own place, to their own therapy group, their own group of other clinicians where they can decompress, right? And so it's making sure that your therapist is taking care of themselves, especially if you're somebody or your loved one is somebody who is in the middle of crisis and just getting that diagnosis and so forth. You want to make sure you've got somebody that's that rock solid foundation, because they're really going to be a huge help or hindrance to you. Absolutely. And unfortunately, like I said, we're working to break the stigma, right? Why would you label somebody that has BPD as a therapist hopper when actually are we looking at ourselves as clinicians and saying, maybe we're part of the problem. Maybe there's things that we need to do to fix it. So I think those are questions that I would ask. Hopefully that was helpful, Leslie. let us know if there's any other questions there.
I think for me, so first of all, it's been so great to hear from Melissa and Tabitha as parents. My experience is so different because my parents were not around during this process for me. And I was so unsure and scared and didn't know where to start. So what I did was I went to the largest health system I could find in my city, because I figured somebody, if it's a practice of doctors, right, not just like a psychiatrist in a small practice, but they've got a teaching hospital, like no matter what's going on with me, someone will be able to help me. So I started there, and I almost feel like I was lucky. Sometimes I hear stories of, you know, hopping from place to place because I didn't know what questions to ask. And I didn't know where to start. But the one thing that really stood out to me in my memory from working with the psychiatrist at the very beginning was they did inform me up front that like medication may not work for me, that I should try DBT. Like, let's do that first. And I was like, okay, you know, open to that. And there because I was in a large city, there was a DBT resource for me. So I do feel like compared to the other panelists, you know, I was just trying to figure things out at that time, and, you know, hearing the kinds of things we could have learned from that Tabitha mentioned, or what like we could have done differently. I think you only know what you know, and having a family member help probably would have been very helpful at the time, but really just Googling. But I will say this, I live in a new city now, and I haven't really been able to get my bearings on a good therapist or even psychiatrist here, to be honest. But I popped in yesterday to the BPD Resource Center with the New York Presbyterian. So plug for that. I'm going to contact them myself because they said they've got stuff in Chicago. And I've been kind of like shopping around. Like, I haven't really been really happy. So I'm going to give that a try. I've heard good things. So just sharing that resource with everyone else, if you are looking for some professional help, that is a resource.
So if anyone else has any questions, they can put them in the Q&A.
I want to say, as I've talked about a caregiver role, but I was actually in a relationship with somebody that actually ended up diagnosed with BPD. And for us, when we went to find a counselor for that person before the diagnosis, it was really interesting to see, oftentimes, and this is true for my sister as well, as everybody, you have your good days. And when you're seeking help, sometimes you're seeking help on your good day, and your therapist will ask why you're there. You're doing great. You're coping well. So on the other end, we have those situations, right? So I think a huge part of BPD Fest and Emotions Matter is education, not only for those that have BPD, but for professionals, for family members, and so forth. So I think it's just important to note that helping spread those resources, like Jillian said, the BPD Resource Center, there really is a lot of resources out there. So helping spread that knowledge is huge, because it boggles my mind sometimes, the things that we see and hear as we all collaborate and work together. So
speaking to that point about the good days and bad days, it has to do with that mood dependency that I was talking about before. And I think it adds to the misconceptions about the diagnosis and the lack of validation about it, because people don't understand the fluctuating nature of the difficulties. And when everything is going well and the mood is calm and all the supports are in place, people look great, and they're often so talented and creative and accomplished and functional. And then something happens and things crash, and the variability is so hard to understand for everybody involved. And sometimes we misattribute certain intentionality to when things are not going well, that, oh, I've seen you be able to cope, and so you're just choosing not to cope right now. And so it's a really important, and there's a lot of trial and error about, okay, what is the level of functioning that somebody has under best circumstances and under less than best circumstances, and having an understanding of that range, I think, is a really important part of it. And also for the person themselves to understand that about themselves, so that they don't get so confused about, why could I do this one day and I can't do it another day? It's very confusing.
I think that that's a great point and segue into, I think, what the next panel is. I believe that's the next one's about disability related to BPD. The next one, or maybe the one after that. But I mean, how true is that? Unfortunately, with my sister, it's been a huge concern. Is some days she can cope and hold a job and be happy, and then she has one bad day, and it literally all goes downhill for her. And how unfair is that? And then when you go in and you apply for disability, they tell you you're fine. You held a job. So it's just finding a way to be able to support that person with BPD, our loved ones, through that. And hopefully, Emotions Matter, SAMHSA, also, they do huge work with legislation and so forth. So those are all, it's huge. It's on an individual basis as a government and working towards that coverage.
I just want to be mindful of the time. We've only got a couple minutes left here, and now we have questions we're probably not going to get to. I want to say his name is Eden or Eden. I hear people often say you should feel your emotions and process your thoughts by just feeling them and letting them pass without judgment. This is very hard for me because I almost always try to reason or fight these thoughts and avoid feeling my emotions to their full extent, although I'm a little better at it now. What are some ways for someone with BPD to effectively manage those feelings and thoughts in a healthy way? I think that's for you, Beth, but I think there's not enough time to answer that question.
Yeah, that's like a long process of, learning how to regulate emotions, right? Learning how to identify what they are and self-validate and understand what triggers them, what kinds of thoughts you have about them, what are the urges that you have to either escape them or try to sit with them. I often have people start to practice by having like an egg timer for 3 minutes. You're going to sit and try to sit with the feeling for 3 minutes, and then have a plan for distracting yourself like crazy afterwards, so that, you start to and habituate and get used to it a little bit at a time, so that, and you have an escape. I think somebody said that, right?
Mm-hmm.
That you have a plan for ending the experience, so you know that you're not going to get stuck in it. But, that's a larger question.
Another one is that celebrating this, from Kathy, celebrating the small steps that you make in your BPD recovery is important. How do you or your loved ones with BPD or your clients celebrate their daily successes?
I guess, I can speak for a second. I was sitting here towards the end of this session, and I'm like, I'm so proud that I did this, and I'm so proud for all of you that showed up here, like listening, like you took your Sunday afternoon to come here and learn. If that's not a small step, I don't know what is. So to me, the fact that we showed up today and we're talking and listening to each other and learning, like, to me, that's a step in recovery journey. So just like at the top of my mind right now. But I think in general, just noticing when things start to not affect you as much as they would have in the past, like, getting out of bed in the morning, walking my dogs, one of the things that I say, like, just all these little things, like, treat them as like a step in the right direction and a step along your recovery journey. The sense of purpose and all of that, I think is, really part of the process.
I think the fact that you can do that for yourself is wonderful. I think that's part of what people need to learn how to do. Instead of think about all the things they didn't do, is to learn how to focus and praise for the things that they are doing. Really important.
It is. All right, so we're going to be ending now. I know there's an example of the safety plan that Beth talked about that you can download. We can't see it, but I believe you can, the attendees from your end. I just want to say thank you to Beth and Tabitha and Jillian. And if you can, please try to donate to Emotions Matter, which through the donate button or the text to give. Emotions Matter needs to sustain their programs. We offer them free to everyone. And I just want to say, we also have the silent auction. Don't forget about that. And I just want to say thank you for attending.
And thank you, Melissa, too.
You're welcome.
Okay.
Thank you so much.
Everybody.